Not all hospitals can be all things to all people. We consolidated obstetrics from 6 hospitals to 5 centers of excellence. Inpatient rehabilitation has gone from 5 to 3 hospitals. We entered into a partnership with Metro Health Medical Center to develop a Northern Ohio regional trauma network. This has improved trauma care across the region and enabled us to eliminate 1 trauma hospital. Ultimately, healthcare systems will be judged, like most other things, on the value they deliver by producing high-quality care at lower cost. We can do this. Cleveland Clinic quality is recognized around the world. U.S. News and World Report this year ranks us 4th in the nation on the honor roll of best hospitals. We have 14 of 16 specialty ranked in the top 10 nationally. To further drive quality, it is critically important to develop, measure, and report quality metrics. 5 years ago, each institute began publishing quality reports, which are also available on our website. This exercise promotes self-analysis, transparency, and quality improvement. The Dartmouth Atlas recently held the Cleveland Clinic up as a model for delivering high-quality, low-cost care. Coincidentally, Mayo Clinic and the Cleveland Clinics, which share the same model of healthcare delivery, were the 2 leaders in low-cost chronic care. If we are to reduce the cost, we must further refine and coordinate our delivery system. We must also reduce the burden of disease in the United States. The major causes of premature death in the United States are related to personal behavior. They include obesity, sedentary life, and smoking. Obesity alone accounts for 10% of U.S. healthcare costs and is expected to reach 21% in 8 years. At that time, Ohio will have the 2nd highest obesity-related spending. We think it is important that we move from sick care to health care. Systematically, the Cleveland Clinic has developed a model to help communities reduce the burden of disease. We began by adopting a no-smoking policy for all of our campuses. We next followed the lead of 6,000 other companies in the U.S. by not hiring smokers. In an attempt to benefit the community, we offered free program of smoking cessation to all the citizens of Cuyahoga County. These efforts contributed to a remarkable change. Smoking across the United States was at 20%, and in Ohio, 24%. In a 5-year period, Cuyahoga County smoking incidents fell from 28% to 18%. This effort may have saved more lives than I have saved in 30 years as a cardiac surgeon, and it demonstrates that it is possible to have a major influence on the health of a community. Encouraged by this, we began to attack the epidemic of obesity. 40 healthy changes were made in the food served to our patients and employees. Trans fats were removed from all the food, and recently, sugared drinks were removed from the cafeterias and vending machines. Exercise and healthy food choices were encouraged with free membership in Curves, Weight Watchers, our fitness centers, and our yoga classes. With an extensive weight management program developed for our employees, they have lost more than 160,000 pounds over the last year and a half. This effort was extended to the community in a partnership with the YMCA and Curves. Response was overwhelming and gratifying. 10,000 people participated and lost 25,000 pounds in 3 months. Cleveland Clinic believes in Cleveland and is dedicated to the welfare of its citizens. We are committed to a healthy environment. To help lead the sustainability effort, all buildings recently completed or currently under construction will receive LEED certification. Solar panels have been added to the roofs of our buildings. Our energy index has improved secondary to multiple aggressive moves. Our recycling program now exceeds our initial goal and is headed towards recycling 50% of our waste. Our community benefit value continues to increase. This includes charity care, research, education, shortfall in Medicare and Medicaid payments. It reached $500 million in 2009, the largest in Ohio. On the eve of the Civil War, Abraham Lincoln addressed Congress, and he said, "The occasion is piled high with difficulties, and we must rise to the occasion. We must think anew and act anew. We must think anew and act anew in responding to the challenge of health care for the citizens of Northeast Ohio and at a lower cost. To ensure our future success as a vibrant and growing international health care delivery system, we will continue to put our patients first. We will hold ourselves to our founders' values. We will take risks with our ideas. We will be creative and continue to drive innovation. We will continue as an important and growing economic engine for this region and this state. We have the vision to think anew and the courage to act anew. I have described to you today a unique healthcare delivery system which has been recognized as a model for the nation. 40,000 employees at the Cleveland Clinic are privileged to serve the citizens of Northeast Ohio and the nation, and we're appreciative of that opportunity. Thank you for your attention.
Today at the City Club of Cleveland, we are listening to a special forum featuring Dr. Toby Cosgrove, President and Chief Executive Officer of the Cleveland Clinic. We will return to our speaker in a minute for the traditional City Club questions. We encourage you to formulate your questions now and remind you that your questions should be brief and to the point. We remind you that members and guests alike are welcome to attend City Club forums and hope everyone listening will join the City Club. We hope you will join the City Club and become active in our ongoing civic dialogue. Please visit our website, cityclub.org, to see a full schedule of our upcoming programs. We welcome all of you here and those listening to WCPN 90.3 FM, WCLV, WTAM, or one of the many radio stations across the nation. Our television broadcast partner is WVIZ PBS IdeaStream. Television broadcasts of the City Club are made possible by Cleveland State University and PNC. Our live webcast is supported by the University of Akron. This Friday, August 20, the City Club welcomes Dr. Eugene Sanders, Chief Executive Officer of the Cleveland Municipal School District, who will discuss Education in Cleveland, Transforming Lives. Tuesday, August 24 at 8 a.m., the City Club will host House Minority Leader the Honorable John Boehner. Next Friday, August 27, Admiral Mike Mullen will address the City Club. For more information about our upcoming forums, please refer to the back of your printed program. If you wish to make reservations or order a CD or DVD of today's program, please call 1-888-223-6786 or 216-621-0082. Today is the Medical Mutual of Ohio Endowed Forum on Healthcare, made possible by a generous gift from Medical Mutual of Ohio. With us today at the head table are Sue Tyler, Executive Vice President and Chief Experience Officer, and Pat Dugan, Executive Vice President and Chief Legal Officer. Will you both please stand and be recognized? Thank you for your support. We are pleased to welcome guests at tables today hosted by Boswick Design Partnership, Case Western Reserve University, the Cleveland Clinic, Cleveland Medical Mart and Convention Center, Cuyahoga Community College, IBM, International Union of Operating Engineers Local 18, KeyBank, Medical Mutual of Ohio, PNC, PricewaterhouseCoopers, Richard L. Bowen and Associates, and Squire, Sanders, and Dempsey. Thank you all for joining us today.